name's Alyssa, and I'm going to be doing a chest tube dressing change on Marcy Paris. I'm going to enter the room and do my initial safety check and introduce myself. Hello Marcy, my name is Alyssa. We're going to be doing a chest tube dressing change. Can you please confirm your first and last name and your date of birth? Okay, Marcy Paris, 1, 2, 3, 4, 5, 6, 7, 8, 9. Great. Okay, Marcy, do you mind if I just raise the head of the bed a little bit? Great, thank you. She consented. And she consented to allowing me to do the dressing change as well. Over here. So I'm just going to raise the head of the bed and also maybe raise it a little bit just for my convenience.
So I need it to be between 80 and 120.
Okay, so I'm also, prior to me doing the dressing change, I'm just going to check the suction over here and make sure that the tubes are all connected. So I'm just turning on the suction. Oh, it was on. And I'm just going to lower it a little bit to low continuous suction. It's in the green. And this suction is also on, and that's working well. So I'm just going to follow the tubing. And I'm also noting that at my patient's bedside there are some safety equipment. So there are 2 clamps right over there and normal saline. And so now I'm just going to look at my patient's pleurovac here. So the pleurovac is set to the 20 centimeter H2O, which is correct according to the doctor's orders, and it's suctioning as indicated by the orange ball. I'm also noting that there's gentle tidling in here indicating the patient is breathing, and there's no bubbling, so there's no air leak. I'm also noting the amount of drainage that is in the tube prior to the start of my shift, so I can monitor it throughout my shift. Okay, I'm just going to get my patient ready for the chest tube dressing change. I'm going to put this to the side. Okay, Marcy, is it okay if I move the blankets out of the way? And she consented, so I'm just moving this out of the way. And I need to put your arm up behind your head, and my patient's in semi-fowlers. And I'm going to expose my patient's wound dressing site. I'm noting that the dressing isn't dry and intact, and I'm just feeling around for subcutaneous emphysema. I don't feel anything like that. So right now I'm just going to prepare my my field here.
Noting that I do have a 10 French section after here.
Okay. Okay, I'm going to aseptically open my tray, noting the 1-inch border. And I might use this as a garbage, and I'm just going to place it here, right on the side of the bed for my patient. So I might put my extra garbage there. I do not need this garbage bag, so I'm just going to place it on the floor.
My conscious patient take 2 to 3 deep breaths, and I'm going to leave it there for about 30 seconds. Also, I'm going to monitor the oxygen.
Bring this off to the side here.
So after that, I am going to remove my patient's.
I'm going to add my normal saline.
I'm just going to put it above his head, but in a place that I can reach it. I'm going to aseptically remove.
I'm going to get an extra drain sponge on my tray.
Remain sterile. I'm just going to hold it on here.
These are drain sponges here.
Put it in. I'm going to make sure that goes in about 5 inches or until my patient reflexes, making sure not to suction on the insertion.
Sure, I'm within that 1-inch border. This is my 4x4 gauze here.
And then that section has been completed, and I'm going to put this in my glove, remove.
And I'm going to remove my jelonet.
And that's going to go.
So in practice, this would be a fresh jelonet, and I would be ensuring it doesn't flop back onto my hand. If it did, I would just get a new jelonet or ask another nurse to bring in a new jelonet.
And then it's all clean.
Okay, this is also garbage here. And I have some mefix for later. So right now I'm going to put on some gloves, and I'm going to remove my patient's old dressing.
And then then remove my other dirty gloves, do hand hygiene, and then I'm going to come around.
I'm going to stabilize this here and remove the tape.
Before I get ready to do the tray here.
Just to make sure this is completely out of the way.
Right, so the oxygen is on. I'm just having problems with the
And I'm just going to move this down. And I'm going to note if there's any drainage on this dressing. There is not, so I'm just going to discard. And I'm going to discard my old gloves. They're soiled now from hand hygiene. And I'm also going to apply another pair of gloves. And I'm going to remove that jelonet.
for my gloves here.
Hands are sticky because of there we go. So I'm going to take this. I'm going to remove the old jelonet and then discard both because this is now dirty. And discard for hand hygiene. Put on another pair of gloves.
So within my one-inch border, however, I'm not certain, so I'm just going to
Okay.
them out.
So
These are also considered so I do have another set here.
So I'm going to be cleaning around the site using rosettes. And then cleaning in a half semicircle
I
garbage.
need another nurse to come in and give me another one. So I am, she would bring me one, and I'm just going to use this one as if she brought me this one.
Cleaning under. Oh, okay. I would make sure I don't go back twice. It just kind of slipped on the tube there. Further around. And I want to clean the area that is going to be under the mefix tape and the 2x4s. Okay, I'm also going to clean the top of the tube and then dry. Discard. And now I'm going to be drying.
Alright, now that I have it all ready there, I am ready to begin the care. So I'm going to do hand hygiene and I'm going to put my gloves on.
I'm going to clean the tube, or dry the tube, sorry. Garbage. Okay.
Alright, so
Okay, I'm actually right now going to apply
that is fine there.
the jelonet.
I'm going to remove, and while removing, I'm going to stabilize the tray. That's going to be garbage, and at the same time, I'm going to remove the dressing.
So in practice, I would ensure this didn't rip.
Hygiene. I'm going to find the gloves.
There we go.
Actually, I'm going to find my
Okay.
sterile gloves to put in the
And in between cleaning and applying the new dressing, I would change my gloves.
noting that I'm not turning my complete into my sterile field.
And I I'm gonna try and not change, put my back towards my sterile field, so I'm kind of on an angle here. Okay, and under here. I'm now gonna apply my drain sponges here. And we want them to be kind of fully occluding it, so we're putting it in two separate directions.
My gloves have been used so much that they're not working the greatest.
Okay. And I'm going to apply a 4x4 to this side. Okay. And now I'm going to remove my gloves and apply my mefix.
I'm going to in. That's in there. I'm going to remove these gloves and do hand hygiene and put my
So I'm just going to discard that mefix because I grabbed extras. Kind of got stuck to a previous one. So I'm going to pull it. This one I dated and timed an initial so that the previous nurse will know when this was, or sorry, the following nurse taking care of this patient will know when the last dressing change was done and when they can do theirs. So we want to make sure this dressing is fully occlusive here. And for this piece here, I want to tent so that if the patient happens to pull on the site, it's pulling on the tape and the tubing and not the site itself. And it's fully occlusive and tape down. Okay, so now I'm going to clean up. So the dressing has been done. My patient, I'm just going to put him in a more comfortable position, put his arm back down, ask them if they have any questions and to let me know if they have any discomfort or pain at the site. I'm going to document in the patient's chart that we had completed a chest tube dressing change and also the contents of the Pleurovac, and that we assessed the suction and the safety equipment was at the bedside and the Pleurovac contents. And I'm just going to, my patient says he would like to stay, or she, sorry, would like to stay in this position. So I'm just going to lower the bed down to a low level. I'm not going to step on this. And clean up the site as well.